And sort of that model of patient-centred care, it's all joined together, this, because our next speaker as well has gone through quite a personal journey and come to a very similar realisation that you have to put the patient right at the centre of their care. Alison Cameron is a remarkable woman, absolutely remarkable, with a remarkable story. So she starts off as a Russian graduate, and she works with those affected in Chernobyl. Her career, though, was cut short when she went through a nightmare. She saw some of her colleagues killed in the line of their work, and PTSD then followed with some horrendous consequences. But this isn't a story of sadness, this is a story of conquering that adversity, not just conquering it, but using those experiences to help other people. She was voted last year, and let me get this absolutely right because it's quite applauded, named by the Health Service Journal as one of the 50 inspirational women in health. Please welcome to the stage, Alison Cameron.
Spot the introvert in the room. I need the lectern to give me the psychological distance. I can't see you anyway, so it'll be fine. Yeah, this is a patient story, I suppose, but it is hopefully a bit of a patient story with a difference. It's actually a story about cardboard boxes, as has just been mentioned. The boxes that we put people in, the boxes that we can hide in, the boxes that it's really quite challenging to come out of, and certainly to think out of. What's the label on your box today? Does anyone watch W1A? Yeah? It's a documentary of some places within the NHS, which shall remain nameless. Is your label Director of Better today? Or Head of Values or something? Is that what you respond when people ask who you are? I had a job title that made me sound like a cheap airline, so let me tell you. I was a PDO, in brackets, international, meaningless. But I thought it was me. I thought I knew who I was. Now, disclaimer time. You may think what I'm about to say refers to the NHS. I didn't work for the NHS. You may think there are similarities. You may think that I couldn't possibly comment. It was a very bullying organization. It was a very political, with a small and a capital P, organization. It was a very fear-driven organization. However, I loved what I did, and I thought I was making a difference. So I struggled on. I struggled on despite the fact that the working culture was absolutely unhealthy for me. People may identify that with that, or they may not. I ran projects in various countries overseas. I'm a Russian speaker, as has been said in that wonderful introduction, thank you. I ran projects around the Chernobyl area affected by Chernobyl, but largely in the Republic of Belarus. In fact, that was quite relevant to what I now do. It was based in the main on those of us in the UK with the power and the money making decisions on what we thought was best for those victims over there. And I realized very early on that we were, in fact, negating the considerable resources that were there in that community by our well-meaning efforts. The people there knew the answers to their own issues. We are our own healers. The role of professionals is to work with us to remove any barriers to us doing that. We are able to heal ourselves given the right help. My work was to come to an end. I was kind of wobbling on the edge of a cliff for a long time anyway, kind of in that culture. It was the kind of culture where when the chief executive came in the building, certain colleagues gave off a stink like an animal in fear when he arrived. That was how I was working. So it was a disaster waiting to happen anyway. The tipping point came And it was 20 years ago today that this happened. My colleagues were killed in working on one of my projects in the Republic of Belarus. My immediate boss was dismembered, and there were other colleagues who drowned. And as a Russian speaker, I was sent over to repatriate the bodies and to sort everything. And I had such a good relationship with the people I worked with in Belarus. We understood each other, that we all worked together to solve what the British Embassy told us would be impossible for these people. We proved them wrong, we certainly did. It was about relationships even then, it certainly was. What made me ill was not the horrific sight of a Belarusian mortuary where they dredged about 20 other bodies out of the river. No one knows who they were. It was the fact that there was an expectation that I keep silent about what really happened that day. There were lots of politicians involved. And I was to be party to a version of events that perhaps was somewhat economical with the truth. Now, I'd always been told I have an overdeveloped commitment to honesty, so I was never going to make a decent local government officer. Their words, not mine. And for that reason, initially I picked up alcohol to help me cope, and I struggled on for a while, but ultimately ended up one day being asked a question at work about the people that I cared passionately about overseas. And I didn't give a damn. I was indifferent one way or the other. I knew at that moment that something profoundly wrong had gone on to my inner self. I had ceased to be connected to myself. Do I understand how lapses of compassion can and do happen to compassionate people? In those bullying cultures, target-driven cultures, where it's impossible even to think or to feel, these are the sort of consequences that happen. I was totally cut off from that. I packed up my desk and I did not go back. I fell over the edge of the cliff and I ended up a maelstrom of mayhem. My favorite label out of all my new labels. I'm a label queen. These are some of my labels I've inherited. I've got others, but they're a bit rude, so I've kept them off because I'm in polite company. Now, I put invisible. I've got a real example here. I was in a posh hospital. I won't tell you which hospital. It was NHS, but it's in a posh area of London. You can probably guess. Now, I'm lying in my bed, and I wasn't looking at my best because I was street homeless by this time. I was sleeping in a car park of Kensington Town Hall, as I always had my standards. I made sure I dossed in the decent postal areas. In my hospital bed by my bedside arrives a very renowned professor, bow tie, the works, and a deputation of genuflecting students. Where are those NHS graduate scheme people? Yeah, you know what I'm saying. And he gesticulated towards me and said, "This one has a social worker. Extraordinary. This means she is," now he had an actual figure and it had about 4 decimal points. He was really into accuracy, this man. 50% likely to end up in prison. So this is what, I didn't actually, because I didn't get caught, but there you are. Maelstrom and Mayhem is my particular favorite. This is a senior house officer in University College Hospital, London. He'd had a really bad night shift and he ended up with me, under the influence of lots of cheap cider and completely traumatized within an inch of my life. Not a pleasant thing. And he was still able to alliterate like this, Maelstrom of Mayhem, he called me. But he also planted a seed in my mind. He pointed me towards a source of support for alcoholism that was readily available and no one had thought to send me towards, because I was in there for my mental health. I wasn't there for the alcohol side of things. So that young man, who's probably a lot older now, he really saved my life that day. He planted a seed that eventually, not right away, but eventually I acted on. So my new CV was as follows. I think, frequent flying card here. But if I've gone through any of the hospitals and so on, anyone present here today, I sincerely apologize. I had lots of great care, you know, fantastic individual bits of care. The danger lay, though, in the gaps. There was a gap between the substance misuse and mental health side. I was far too mad for the substance use people to cope with me and far too drunk for the vice versa. There was a big disconnect between both of those and the social care side. And then housing, oh yes, now housing was existing on a different planet altogether. It wasn't even anywhere near the equation. So to see a stand from housing associations right by the door here, boy, is that progress. We have got to start considering the impact of housing. One more label I forgot was bed blocker. I've been a bed blocker. Any taxpayers in the room? Yeah, you look like taxpayers. Yeah, this was my bed on the first night of my recent admission, which was just over 2 months ago. My housing is not safe for someone who is noise sensitive and has post-traumatic stress disorder. So I end up ill again, and I end up occupying a bed that I don't need. I wasn't alone. There were no beds in the entire mental health trust. Central North West London NHS Foundation Trust had no beds at all. So this, in a suicidal state, was my bed on the first night. This is a blue armchair, obviously, stating the bleeding obvious. Because on the wards were people who were absolutely well to be discharged, but could not be because their housing would immediately render them ill and then back in again. So, you know, I actually was a bed blocker for 1 whole year. I had been housed underneath a known crack den, which was not very healthy. In fact, it was a paramedic who had relapsed on crack and established a crack den above where I lived. And so it was too unsafe for me to live there. I got trapped in the mental health unit. So forget any thoughts you may have that people blocking beds, and I'm deliberately using that language because it is very harsh and very stigmatizing. But this is, so to be labeled this, you can imagine, if you can, how that feels. It's not just older people waiting for care packages. This is happening all over, and it is because of the disconnects between the various parts of the services. I think probably the most corrosive effect, though, was that I ceased to have any capabilities. I became a bundle of needs. Now, I'd worked with world leaders. I'd worked with Mikhail Gorbachev. I'd traveled the world. I'd won awards. In fact, I had to win awards. I was in such a, such a corrosive culture that just to survive, I felt I had to win awards. Best contribution to world harmony, and I was sitting swigging vodka to get in there, to get it together enough to get my award. That's how harmonious I was at the time. But never mind. I felt that any abilities I had were now somewhat cryogenically suspended in another room somewhere. It's a very strange feeling. So I was kind of quite happy to be taken care of, to be healed in a way. I didn't have to make any decisions for myself. I loved ending up drinking myself into a lovely private hospital where the NHS had a contract, and they filled me full of Valium, and I got to talk to the rock stars and Saudi princes all day long. And it was great, and I didn't feel frightened. I didn't have to face anything. And if you'd have asked me to get involved in redesigning services, I wouldn't have known what you were on about. I was totally disconnected from any ability to make decisions. I couldn't decide between shampoos in a shop when I came out after my first long-term admission. And I'm quite a decisive person and known as such. But I met some people along the way, by chance, or is it by chance, I don't know. I heard Dr. Rachel Perkins speak about her experiences of being diagnosed bipolar while working as a clinical psychologist, and it had actually enhanced her work and opened new doors for her. So it kind of, again, it's all about planting seeds, this that I'm talking about. It planted a seed in me that, in fact, it might be the start of something what I was going through. And I made a concerted decision then to learn what I could from being in an acute psychiatric unit when I never had any experience of mental health conditions of that level in my family or anything, to suddenly be there and think, this I can see as an opportunity and it might just start something. I met a rather elegant lady in a loo at a mental health service user meeting, and we were chatting, as you do in the loo, of course, chatting about dual diagnosis provision or lack thereof. And she turned out to be the chair of the Mental Health Trust, Dame Ruth Runciman, and she sort of plucked me from obscurity and whirled me into the world of service user involvement. Oh yes. It certainly got me off the sofa and away from the Jeremy Kyle. I started to get involved in committees and focus groups, and more focus groups, and lots of questionnaires and that kind of thing. And at one time I was on the dual diagnosis committee, 3 of them. One in my borough, one for the whole of the trust, and one that was based at the King's Fund in the London Development Centre for Mental Health. And I was the only person who was on all 3 of those, and I was the patient not being paid to be there. And I was the one relaying information from one to the other, because they didn't talk to each other, those 3 committees. And they were each arguing about a definition of dual diagnosis, and I was just passing on what the other lot had said and that kind of thing. You know, dead obvious. It's great as far as it goes, and it's really good to get this stuff right, such as collecting data and capturing experience. But people who know me, I get the feeling Jeremy Taylor is likely to be here, know how I feel about this stuff. Consultation fatigue, add that to my list of diagnoses. I have had my experience captured more than I've had bad NHS curry, and they had curry on the menu every single day when I was on the ward. It's not about capturing my experience and then going off and doing something about it that I never get to hear about. It is about liberating my experiences, and we are indeed birds that if we're allowed to fly, that a lot can happen. Very little actually seemed to change from a lot of that, and it did seem like a tick box exercise. So I was left with a lot of motivation, a lot of anger, and nowhere to go with it. I knew I wanted change, and actually I wanted a revolution, and I wanted it to be like the Napoleon. I've also got Napoleon in my presentation. That must say something, mustn't it? This was what I believed it had to be. Blood on the walls, and preferably not mine. The Napoleonic view of now, that's great, but I have to kind of dob myself in here as the angry patient with the axe to grind. There we go. When, you see, we don't have the same level of opportunities to have training and development and learning how to use the dialogic approach and all of that. We're just good and angry. And so if we feel there's no outlet for that, then no wonder we turn up at meetings and have a good old rant about the car parking. That is the sort of thing that's likely to happen. And I was doing that, and I would have hated to have been on the receiving end of me at any of those committees from that period. But I was lucky enough to get an opportunity to learn, to be trained. I was sent by my mental health charity on a course which was run by what became the Centre for Patient Leadership in effective patient and community representation. And that was really key for me, because it taught me how to work much more constructively, to start to reconnect with those old skills that I'd had before. I knew how to influence before. I worked with politicians. I had them all house trained. I was good at that stuff. I needed to get back into that. I needed to regain some confidence, because the biggest wielder of the stigma axe was myself, towards myself. I bought into that. I bought into the Daily Mail scrounger stuff. all that stuff about hardworking people when I'm not working and all of that, I honestly believed I didn't have any real worth. And actually sitting around a table where I'm the only person not being paid and living in considerable poverty, it does actually fuel that feeling of lack of worth. So it was a really, really important course for me to go on, and it was very important that it was run by people who themselves had significant experience of life-changing health conditions. And, you know, there should be more of that, definitely more of that available. It's I don't use the term life-changing lightly, but it has been for me. After doing that, I became a fellow of a collaborative for leadership and applied health research and care for North West London. That's one of the Clarks. Now there, I was a fellow working and learning alongside clinicians and other healthcare professionals, absolutely as an equal, not a parachuted in patient or a walking patient story, but actually working together and learning and developing together. We all had the same bursary. It was a really rare example of that kind of thing. I was sent to a conference in Sweden. Now, I couldn't have made it to Swindon, I can assure you, given how ill I was. I hadn't had a passport for 10 years. So all of those things, they really helped me just reconnect with myself. It was such an amazing opportunity, and I'm still attached to Clark, and it's a really good example, their fellowship, of the sort of thing that can be achieved with relationships being established between patients and professionals where the boundaries are blurred. I went on from there to kind of almost gate crash the NHS Leadership Academy. I'm known for my Twitter rants. So I'd ranted on Twitter. I think that, well, I've noticed that your courses aren't open to the likes of me, you know, not in the paid hierarchy. And they called my bluff and offered me a place. So I had to do the work then. So this is me actually at my graduation, where I graduated with a postgraduate qualification in healthcare leadership. And it's really key to do this kind of stuff. A lot of my work was about insisting that all you professionals walk in my shoes. And I still think that's a really great thing. What I had to realize was I needed to know how to walk in the shoes of the professionals as well. I needed to know about the realities that you're all facing. And how difficult it was for my fellow students to be juggling the demands of their jobs. A lot of them were frontline staff. It was the Mary Seacole program, so that's designed for that level. And they were giving their own time to do this course, and it was demanding, and it was hard-hitting. It started on day one with mid-staffs in full detail. It did not hold back. It's an absolutely fantastic course to have been on. So it's kind of made me tone myself down from militant to radical. I am I do like chaining myself to railings on occasion, but I do try to kind of choose my fights wisely these days. So now, you know, it has opened doors to me because I suddenly had the belief that I could do it. I have to, at this point, pay tribute to Helen Bevan and Helen Bevan's team at Horizons, because Helen, being the doyenne of boat rocking, decided that she wanted a very outspoken boat rocker to join her. So after 17 years of not working in any sort of a formal way, I found myself going back to work. I set up my own company, and my main regular work is with the team who are here from The Edge, and I write for the online publication The Edge. And if you haven't signed up, you better do. If you want to hear more of the kind of things that I like to rattle on about, you'll find it in there. And that's a risky thing, you know, because the NHS is very hierarchical. I've got no actual credentials within the system whatsoever. However, we're there, and it's challenging for everybody because it is groundbreaking, but it's the way that things need to go. It really is. It's a new way of working. I'm also extremely honoured to have been made an associate of the King's Fund. I used to sit in the corner of the King's Fund, in token patient corner, I used to call it. And I used to time how long it would take them to say, "We are putting the patient at the centre of everything we do." We weren't actually present apart from me, in the room I mean, this is years ago, obviously, but we're certainly putting the patient. I just say, well, do you know, I'm rather sick of being put to places. If the conditions are right, I will be at the centre anyway, so you don't need to put me anywhere. But yes, there's some exciting developments at the King's Fund, working with patients as leaders, in the sense of shared leadership, because I don't see leadership as a place in the hierarchy. It's about a set of values. If you look at any of the very many leadership models out there, it's all about leading oneself, all of those qualities that they can and do apply to patients like myself who are engaged in working for change and influencing change at all levels, up to and including strategic. There's no such thing as the typical patient rep anymore. We're to be found all over the place. These are some of the, so it's not about role, it's about qualities. It's about how we work, how we form relationships, how we engage in dialogue, even when it's really painful stuff. Because it's our lives we're talking about here, it's not a job. Here are some specific examples of some of the fantastic patient leaders out there who are working. Now, some of these are entrepreneurs designing apps to manage health conditions, long-term health conditions, like Michael Sears. There's people like Anya de Jong, who was a medical student and now works with medical students, training them on self-management. There's activists, there's people doing work with CCGs like Karen Maskell. There's Sue, who is employed by the NHS running peer support and increasing understanding of personality disorder. We are out there. We're probably right under your nose. So have a look in your organization and see where we are, because we are potentially very, very powerful allies, and we need all the allies we can get at this time. So my approach is somewhat toned down. I realize now it's probably more effective to plant seeds rather than Semtex. It's probably not so much fun, but it is ultimately more effective. So this is probably, you have to get Gandhi in there, don't you? It is about relationships. It is about creating the conditions where professionals feel safe enough and have the permission to do so, to say, I do not have all the answers, or I am scared shitless over this stuff. That has happened. That has happened when I've been working with the King's Fund Top Managers Programme, various other workshops I've run, where we seem to give people permission to start going into that quite difficult stuff about how this really feels in a time of chaos, in a time of constant change. When I think what I was like in my old job, where I felt like I was just spinning all the plates, keeping the plates in the air at once, to have someone coming along who wasn't even in my organization sort of telling me maybe I should be doing my job differently, I would not have taken it kindly. It would have really freaked me out. So I understand the challenges right now of having to look at perhaps sharing some of that power. It's quite daunting. This is the F word. The fear is something that's a shared experience. It's not a them and us thing. I've had quite a bit of resistance to the way I work from the patient side as well. A patient governor came up to me and said, I don't like what you're doing. You don't want patients to be patients, and you don't want doctors to be doctors. But actually, I had to look at myself, reflect on this, and realize that yes, I was actually rather comfortable in the patient box. It was pretty shit in there. I'm wondering how they're doing the subtitles of some of my stuff. It was pretty shit in there, but it was familiar. And that's the thing about boxes. They can provide us with some sense of safety when perhaps there isn't much around. I love working with people at the start of their career. I worked with the absolutely fantastic NHS graduate scheme on their very first day in Leeds last year, and it really is wonderful when you see light bulbs going off and you get people coming up saying, I now know why I'm doing this course. I got an email from one of them who was about to start her first night shift on her placement in an A&E. And she said, I am seeing what you said in every patient that I am seeing, every single one of them. And I realized how much I love what I'm doing when I see that happening. It is, I used to feel it was survivor guilt, that I had to do it because I made it and a lot of other people didn't. Like my lovely ward mate Edmund, who was found dead in his supported housing. He fell through the same gaps as me but didn't make it. I used to think it was about that. That's still a lot of my motivation, but actually my real motivation is that I really believe in it, and it really gives me hope for the future of the NHS. It really does. And my advice to them always is, if you can, start breaking down those boxes, the walls of the boxes, while they're still made of cardboard. Because if you don't, fear will cause the walls to petrify into stone. And then you're left with bunkers. And the bunkers, the defensive bunkers, they're the silos, and they're a hell of a lot more difficult to demolish when they reach that stage. So that's my message, really. If we work together, and we work in such a way that we can acknowledge the shared fear that some of this brings up, the shared experience of that, then we can really get somewhere. None of us have the whole picture. We've all got essential parts of it. If you bring that together, that bit in the middle, it's where the quite gritty and difficult stuff is, but it's where the hope is, it's where the creativity is, it's where the innovation is, and it's where that social movement potentially is that Simon Stevens talks about in the 5-year forward view. And that is what I advocate, that we concentrate on for the future, for the sake of all of us, for the sake of the NHS. Thank you for listening.